Today we will be talking about Medicare Supplement Insurance, and I will help you understand what is that and navigate various plans. So let's start with the main question. What is a Medicare Supplement Insurance or Medigap? A Medicare Supplement Insurance policy helps pay some of the healthcare costs that original Medicare doesn't cover, like copayments, coinsurance, and deductibles. Medigap policies are sold by private companies. It is very important to pay attention to various rules that apply to Medicare supplement, eligibility, and enrollment. I have quite a few videos on this channel about Medicare supplement enrollment times, as well as important things to know about these plans, so please feel free to check it out. Also, I have to mention this, Medicare supplements no longer cover prescription drugs. So, individuals who are enrolled in a Medigap plan may only obtain Medicare drug coverage or Part D through a standalone prescription drug plan. Most Medigap plans pay for some or all of the following costs. Part A coinsurance and hospital benefits. Part A deductible, coverage for 365 additional hospital days when Medicare coverage ends. Hospice care coinsurance or copayment. Skilled nursing facility care coinsurance. For Part B coinsurance or copayment. Part B deductible, some plans will still cover it. Part B excess charges and blood, the first three pins, which are also covered under Part A, as well as other benefits like coverage for foreign travel, foreign emergency that is not covered by original Medicare, and non-Medicare covered preventative services. Now, it is important to know that Medigap policies are standardized. Every Medigap policy must follow federal and state laws designed to protect you, and it must be clearly identified as Medicare Supplement Insurance. Insurance companies can sell you only a standardized policy identified in most states by letters. All policies offer the same basic benefits, but some offer additional benefits, so you can choose which one meets your needs. The Medigap policy covers coinsurance only after you've paid the deductible, unless Medigap policy also pays the deductible, of course. Very often, my clients ask me to explain the difference between all those plan letters, and the best way to understand them is by comparing side by side. So let's go over various plans and benefits. There are 10 different Medigap policies, and each one comes with a standard benefits across the nation. The exceptions to this rule are states as Massachusetts, Minnesota, and Wisconsin, which standardize Medigap policies a little bit differently. In order to buy a Medicare supplement plan, you must also have original Medicare, and this is very important. This includes Part A and Part B. You can buy Medigap policy from any private insurance company that's insured in your state and that sells it. Not all insurance providers offer every Medicare supplement plan, but every healthcare provider who accepts Medicare must also accept your Medigap policy. How to find the least expensive Medicare supplement insurance? While the 10 Medigap policies feature standard benefits in 47 states, the costs for those plans can vary substantially. That's because each insurance company establishes its own premiums and pricing structure. Factors such as gender, tobacco usage, and marital status typically affect rates. Now remember, the least expensive time to buy a Medigap policy is as soon as you are eligible. Your Medigap open enrollment period starts when you turn 65. During this 6-month period, Medigap policies do not require health underwriting. This also means that you will not pay more than you should for your Medicare supplement in certain cases. So let's start comparing these plans. First, we will take a look at Medicare Part A coinsurance and hospital costs. As you can see, all of the plans cover Medicare Part A coinsurance and hospital costs up to an additional 365 days after Medicare benefits are exhausted. Medicare Part B coinsurance or copayment, generally Medicare pays 80% of these costs. All plans pay for some, all of the remaining 20% as indicated on the comparison chart. Blood, first 3 pins are covered by, all plans pay for some or all of the first 3 pins as indicated on the comparison chart, and Medicare pays 100% of any additional blood needed. Part A, hospice care, coinsurance or copayment. All plans pay for some or all of the Medicare copayment or coinsurance as indicated on this chart, again, depending on the plan. Skilled nursing facility care coinsurance. Medicare pays all of the first 20 days. Then it pays a fixed amount per day of the 21st through the 100th day of approved costs. Medicare pays nothing after the 100th day. The Medicare insurance plans pay for all, some, or none of the first 100 days deductibles or copays, again, depending on the plan. Part A, deductible. This is a hospital stay deductible. The plans pay for all, some, or none of the deductible as shown on the comparison chart. Part B, deductible. This is an early deductible you must pay before receiving any covered Part B benefits like doctor visits and most other outpatient services. Now, I want to mention one more thing, which is very, very important for individuals newly eligible to Medicare. The Part B deductible will no longer be covered by the Medicare Supplement Insurance starting with year 2020. Therefore, Plans C and F will no longer be an option for newly eligible individuals starting on January 1st, 2020. However, individuals who already have Plans C and F will be able to keep their current versions of the plans, and individuals eligible for Medicare prior to January 1st, 2020 can purchase the current version of these plans on or after January 1st, 2020. Part B, excess charges. This is an amount that a healthcare provider is allowed to charge above the Medicare approved amount. Only plans F and G pay this benefit as shown on the comparison chart. Foreign travel emergency, as I mentioned earlier, this is a medically necessary emergency care not covered by Medicare. The benefit is generally 80% and has a lifetime maximum with a $250 deductible. Although the supplemental plans can offer more comprehensive coverage than Medicare Parts A and B alone, they generally don't cover long-term care, vision or dental care, hearing aids, eyeglasses, or private duty nursing. Please make sure to watch my upcoming video where I compare various Medicare supplements plans and costs. All this information is provided at no cost to you. I will highly appreciate if you share, like, or comment under this video. Also, please feel free to subscribe to this channel. By doing so, you will greatly support my efforts in growing the channel's community and help spread the word about our educational videos. Thank you. Please stay with us.